Good day everyone, this is Dr. Razuma. Today we are going to talk about diabetes peripheral neuropathy. Some of you might be asking now, what is diabetic peripheral neuropathy? Some of you, it's not for the first time to hear this term. So diabetic peripheral neuropathy, it is a type of nerve damage that affects the feet and legs and sometimes the arms and hands. It is one of the leading causes of morbidity in diabetes. It affects almost half of people with diabetes. 26% of type 2 diabetes have signs of neuropathy at the time of diagnosis. Symptoms. What are the signs that will tell you that you have that will make you to suspect that you have diabetes peripheral neuropathy? Pain, burning or tingling sensation or numbness on the feet and toes and also the hands. Some may also present with the exaggerated sensitivity to light touch. This is where you feel a lot of pain while you are touched, for example, being touched by something like a blanket or just a light cloth. The pain is worse at night and it usually affects both. Mostly it's seen first on the toes, then it moves slowly to the legs, the mid-calves, then it can go to the hands. This is something that is called also called stockings and gloving. So you may be asking yourself, who is at risk? So people who are mostly at risk are people who are suffering from high blood pressure, those who smoke tobacco, those with hyperlipidemia, and those who have poor glucose control, whom their glucose are not controlled, and also a long-standing history of diabetes, and also those who drink alcohol excessively. How to diagnose diabetes neuropathy? So once you have all these symptoms, what you should do is to go to your healthcare provider and tell them about the signs or symptoms that you are having. So when you come to us, what we'll do, it will be to take history and also to examine your feet. One of the tests that we do carry out on physical examination is monofilament test. This is one that you can see there, where we take you can see a nylon there, which is being put on is pressed on the foot. This is done to test the sensation, and loss of sensation. It's one of the signs that will tell us that this person is having signs of diabetic peripheral neuropathy. Another test that is done is tuning fork test. This is you can see there on the second slide, the tuning fork test. This test is done where you have to check for vibration sensation. And loss of vibration will also be another sign of diabetic peripheral neuropathy. And we also check the nerve fluids. Other tests like nerve conduction studies, nerve biopsy, MEG tests, they are not necessarily needed, but they can be done. But it's not all tests. Mostly only those tests that I mentioned will be done. So you'll be asking, this condition, can it be treated? How can I prevent it? Yes, you can prevent it. We can try to also delay it. If you already have the symptoms can be improved. So how can you do that? By controlling your glucose. So symptoms such as burning sensation and pain they can improve. If not control on current medication for type 1 diabetes, insulin frequency can be increased, or we can change to insulin. And for type 2 diabetes, we can increase the dosage and frequency of oral medication, or add another oral medication, or even add insulin. So another thing that can be done is a lifestyle modification. Diet, physical activity with the goal of achieving a normal body weight. With the diet, what you can do, mostly the low in saturated fats, high whole grains, vegetables, fruits, limit, and physical activity is mostly the required minutes is 150 minutes a week. These 150 minutes you can decide on your own whether you want to spread it throughout the week, or maybe you want to divide it in 3 times a week. However, before you can start any physical activity, you also have to sit down with a healthcare provider where you decide which physical activity to make sure that you don't injure yourself. Another thing that you can do is to quit smoking. If you're smoking, you have to quit. Smoking decreases blood circulation to the feet, and if you smoke, quitting will improve your health and also reduce your risk of complications. The third one is the food care. You have to take care of the feet. So how can you take care of the foot? You must avoid walking barefoot. Avoid using a hot water bottle on your feet. Avoid getting into a hot bath before testing the temperature. So don't test it with your legs inside. First, start by just testing it using your hands, and then cut your toenails straight across and avoid cutting on the side, or cutting too short. You have to wash your feet and check them daily, like the way you check your face. Wash your feet with warm water, and you must dry it thoroughly, and make sure that even between the toes you dry them. If you notice any abnormalities on your feet, such as a cut or blister, please report to your healthcare provider. Don't try to open the blisters on your own. Another thing that you have to do to take care of your feet is to choose the shoes that fit snugly, that fit you well. Avoid wearing tight shoes. Another thing is about the socks. Wear the socks that are loose, not tight. Preferably cotton, which it will cause less irritation. Get regular fit check from your healthcare provider. The full feet examination is at least once a year if your feet are fine, and visual examination, like just checking your examination without carrying other steps, it can be done at least at each visit. So if your healthcare provider is not doing that, please start asking. The fourth thing that you can do is the pain control. We have drugs that are used for pain control. These are drugs that are also used for other conditions. We have antidepressants, drugs like amitriptyline. We also have anticonvulsant drugs, anesthetic creams, and alpha-lipoic acid, and also used to lessen the pain. So now another thing that you might be asking yourself, what is the worst thing that can happen with this condition? What is the worst? If I don't follow all these things that Dr. Azuma was mentioning, what can happen? Remember, one of the problems with the diabetic peripheral neuropathy is the loss of pain, cold or hot senses. So it increases the risk of injury on the feet. And then when you get injured, you won't be able to even recognize that you are injured. So this might continue to a big ulcer without even you noticing it. And subsequently, there will be it will lead to infection. And the problem is with diabetes. Diabetes it's difficult for wounds to heal. So that wound that is not healing, it can get worse and lead to amputation of your toes, foot, or also the leg. So you can lose your leg. And the worst thing that can happen also is death. In conclusion, people with diabetes who are not compliant or people with poor glucose control are at high risk of suffering from diabetes complications such as peripheral neuropathy. And this can lead to breakdown of skin and ulceration. And please, let's take care of our toes and let's prevent all this breakdown and ulceration. Until we meet again, goodbye.